was born in India, and we always spoke English at home. And I moved to Texas when I was 10 years old and lived in El Paso. I consider myself a Texan. I moved to San Antonio when I started college, and I went to St. Mary's University. My father was a pathologist and was a great influence on me, and I grew up around physicians as well. So I enjoyed caring for people, so I knew that being a physician would be a great fit for me. After I finished medical school, I went and did my family practice residency in Corpus Christi at Spahn Memorial, and that education gave me a great base for what I do today. Family practice is a broad field, so I do a lot of things to keep up to date. One of the things is going to conferences regularly. The second thing that we do is read a lot of journals in order to keep up with the current literature. And I also use the internet to keep up to date with colleagues from all around the world and keep up to date with the changes that are occurring in family practice. In my practice, I see a wide range of patients from childhood all the way up to the elderly, and I enjoy seeing all different types of medical problems, ranging from a child with an ear infection all the way to an elderly person that has multiple medical problems. So I see a lot of diabetics in my practice, and we make sure that all aspects are taken care of. For example, we make sure that their cholesterol is under good control, as well as their blood pressure, and of course making sure that their glucose or their sugars are under great control so that they don't develop complications from the diabetes. I recently saw a patient in our clinic that presented with a 2-day history of pain and swelling to his leg, and I thought it was a blood clot, and it turned out that it was. And we placed him in the hospital and put him on the appropriate medications, including blood thinners, and he did very well after that, and we've seen him in our clinic for follow-up, and at this time he's doing fantastic. I enjoy reassuring people, and I recently had a gentleman that came into the practice with chest pain, and he thought he was having a heart attack. And I examined him, and we did an EKG, and it turned out to be completely normal, and we reassured this patient that he was not having a heart attack, and in fact had a simple condition that could be treated with some anti-inflammatory medications. Patients enjoy the convenience of being able to be seen without having to wait 2 weeks for an appointment. And we address multiple medical issues, ranging from respiratory infections to lacerations to even minor broken bones. I have a great relationship with a lot of specialists that we use in the area, with some of the gastroenterologists and the cardiologists, and especially the ophthalmologists in the area. And we can always pick up the phone and call them up and get some advice from them, as well as if we need to get a patient in to see them quickly, they always have availability for our patients. And medical care is expensive, so we examine patients carefully and only order the tests that we find that are absolutely necessary. Well, I feel that my duty as a physician is to care for the entire patient. So I like knowing that patients can come in here and can bring any problem to me, whether it's a physical or ailment, or whether they have some type of stress in their life, or they can bring anything that they want to me, and I'll do my best to address it. And I like knowing that the patient leaves here comfortable, and knowing that what they presented with was appropriately addressed, so when they leave they're happy that they came in and know that they got the best care possible.